And so if we look at AI 1.0, just remember encoded human knowledge and statistical methods, AI 1.0. The earliest paper I'm aware of that worked on AI 1.0 in diagnosis is from 1963, not 1970 as we saw in the video this morning, of understanding EKGs and making diagnoses out of them. A better known innovation was MySyn, which incorporated infectious disease specialty knowledge in 1977, and there were a number of others in this field. But things really took off in the era of AI 2.0, the deep learning era. And the important thing that differentiates this from the AI 3.0 era is it is task specific. It does one thing at a time. If you have a model that detects breast cancer, and you give it a CT scan for low-dose lung cancer screening, we'll have no idea what to do. It can't do that. What do you need if you have a breast cancer model and you want a lung cancer model? You need an entirely new data set, 20 engineers, and a year to get it right. That's the era of AI 2.0. This is a paper from our group, foundational paper in the field, published in 2016 with Aravind, just south of here, about making a classifier that was as good as board-certified ophthalmologists at detecting diabetic retinopathy. This is, we've worked on this for more than a decade. It's now, technology that's come out of this paper has now screened more than 600,000 people in India and Thailand in particular. But I want to show you the impact of the timing of this. These are papers in PubMed that mention deep learning or convolutional neural networks or these other architectures. And you can see them start to increase over time to 2016. And then the field exploded. And most of what we've talked about today has been in the AI 2.0 era. It's been breast cancer detection, pathology, the little animated thing. We made an augmented reality microscope to help circle the cancer when you're physically moving the slide around. But we saw it lung cancer, genomics, breast cancer, more sophisticated methods of eye disease, and many, many, many groups have now published on this. But it's task specific, one thing at a time. What happens in AI 3.0, the era of foundation models, is something that's different. And we've seen a huge spike in popular interest. The chart at the top is just how often people search for AI. We've seen covers of major medical journals, and we've seen really good science start to come out of this era. A critical thing about AI 3.0 is it can do many different tasks without retraining. And you know this if you've played with one of the chatbots. You give it one sentence and say, write me a poem. Another sentence, say, write me an essay. Another sentence saying, help me with my homework problem. And it can do that, and you don't have to get another data set, 20 engineers, and a year to do that. I'm going to give two examples of work that we've done, and I'm going to give them an example, not because each one is particularly important, but as an example of the speed of the field. So this all happens over a span of 13 months. We first looked at medical question answering. This has been held out as a grand challenge in AI for decades. And licensing exam style questions are a great example of this. For the physicians in the room, how many people have taken an infinite number of exams that look something like this? Right? Nearly everyone will have taken many things like this. This is a real example of one of the questions. There's a data set that's like a medical licensing exam. The data set's called MedQA, and people have been working on it year over year, getting better 3%, 5% at a time. And 60% is about where a US physician would pass the licensing exam. We don't know exactly, but it's somewhere in there. All of a sudden, we saw this dramatic improvement across the line of passing, clearly across the line of passing, and then into expert level performance. Places where you start to see the noise in the test itself for that. Remarkable achievement and a change in the slope.